Thank you for joining us for another episode of Curiosity Corner. Dr. Aiden and I are going to review The New Menopause by Dr. Mary Claire Haver, and we both read it this time, and I would say I really like it.
I think it's a great resource for anyone who's interested in learning a lot more about menopause and kind of the history and where to take next steps.
Yeah, it's a little bit science heavy and a little bit like medicine heavy.
Yeah.
So if you're not into jargon, you might not like this book too much.
Yeah.
But the resources she gives are really detailed and really helpful.
Yeah.
Yeah, my overall summary is it's a worthwhile read. There's a couple of points I think we both want to hit on from this book too, to discuss a little bit deeper. One I would say is that, for a long time, we've thought about menopause as being a danger to our bone health and to our cardiovascular health. And there really hasn't been enough research, and Dr. Haver really points to this too, in what really happens in a menopausal body and what that transition does to us. And there are a lot of other conditions that we are at risk for after menopause. So dementia is one of them. Another one to consider is actually musculoskeletal concerns. So an increase in joint pain, arthritis, even frozen shoulder. We start to lose muscle mass as we age as well.
Oh, there were so many. So, she lists them all out of things you could expect to see, but those were kind of the key ones that often go missed. So when people are thinking of like brain fog, it's, your brain is really rewiring. So again, kind of a key thing that can't go missed.
And then metabolic health is the one I was forgetting that I wanted to make sure I mentioned.
Yeah.
Because our insulin resistance goes up, we start to gain more visceral fat. And visceral fat is the fat around our organs, and it's much more dangerous than the typical fat deposits we get. So that metabolic shift as well is really important. As we lose estrogen, our inflammation just increases. I really like how she highlights the medical concerns that are happening and the need for more research as to exactly what are the risks associated with menopause, and then what can we do about it.
Yeah. And I think she had a really good call to action too for both medical institutions and providers to learn more, and kind of a call for more continuing education in this field too, just in general for providers to be able to speak to their patients better.
Yeah. There seems to be a significant lack in research and a lack in education, even for OBGYN providers in the menopause area specifically.
Yeah. Well, and she highlighted as well about the Women's Health Initiative study and kind of the flaws that came out of that, and she highlights some protocols depending on what stage you're in and what your concerns are too, which is kind of great. And I did like too that from a more holistic standpoint as well, she covers some foods you can incorporate, different dietary approaches, supplements, and things like that too. So it's a great starting point.
Yeah. And one thing that she talks about that I think we don't talk about enough is this transition that happens when folks have been on birth control for a long time. What do you do in your 40s, in your 50s? Do you stay on birth control, which suppresses ovulation? And so it's a higher hormone level than HRT is, or you switch to HRT, and when does that switch happen? So if you are on birth control and you're in your 40s and 50s, you want to talk to a provider about what is the plan for menopause, what is the plan for perimenopause, and how do you make that switch from birth control, which again, higher hormone level, to HRT.
And she also arms patients with different topics to bring up to your provider too, like what to look for in a provider and kind of the questions to ask to see if they'd be the right fit to help you develop that plan.
Yeah, and if you still have concerns about taking hormone replacement therapy, it doesn't have to be oral or systemic. There's a lot of benefits too with topical, because there's a lot of genitourinary symptoms that can happen in menopause as well, and so topical estrogen can also be really helpful for those symptoms. Yeah, we highly encourage you, if you have ovaries, to read this book.
Yes.
Yeah, it's a great resource. And if you aren't a big reader, Dr. Haver also has been on several podcasts lately. She's been on Brene Brown's Unlocking Us. She's been on the Hebrew Lab podcast. Both are really excellent to listen to. And then she's got a big social media presence. So she's on TikTok, Instagram. So you can get her information lots of different ways. And a great website with a list of providers. Thanks for watching.
Yep, we hope you found this helpful.